Hello, my name is Viet, and I will be recording this micro lecture on Chapter 4 Current Health Issues for Current and Emerging Rural Health Issues in the Southeast United States. There has been a shift in the causes of mortalities over the years. It has shifted from infectious diseases to more chronic conditions, as the leading causes of mortality in modern times demonstrate. The top ranked leading causes of mortality in the year 1900 were pneumonia and influenza was number one, tuberculosis was number two, diarrhea and enteritis was number three, the fourth was heart disease, and the fifth was stroke in the year 1900. If we look at more recent leading causes of mortality for the year 2022, for example, the number one cause of mortality was diseases of the heart, followed by malignant neoplasms. Number three was accidents. Number four was COVID 19. And number five was cerebrovascular diseases. It changed again in 2023, with the first three not changing, number four becoming cerebrovascular diseases, and number five becoming chronic lower respiratory diseases. Of the various major health issues that is faced in the southeastern USA, there are three that are areas of concern. The first of being coronary heart disease, or CHD. The second is diabetes. And the third is obesity. We'll look at each condition individually and how they affect each state. The first condition we're going to talk about is coronary heart disease. And what exactly is that? Coronary heart disease is a condition that's associated with the narrowing of coronary arteries, causing partial or total occlusion of the principal coronary arteries. These are the veins that deliver blood to the heart. And of course, with their partial or total occlusion, it leads to diminished blood flow to the heart. Diagnosing coronary heart disease revolves the use of electrocardiograms or ECGs, various imaging technologies, stress tests, and cardiac angiograms. Oftentimes, we see coronary heart disease and coronary artery disease used interchangeably, but coronary heart disease is a result of coronary artery disease. We can find this map on page 71 of the textbook, which shows the coronary heart disease prevalence for the study area that we're examining, which includes the states Tennessee, Georgia, Alabama, Mississippi, Louisiana, and Arkansas. And we can notice that the rates of coronary heart disease fluctuate, but it remains a persistent problem in southeastern United States. The social determinants of health are non-medical factors that influence health outcomes. These include things like housing, education, safety, employment, and access to care. As we can tell with the lighter shaded areas towards metropolitan areas that the instances of coronary heart disease are less. And it's because urban cities generally have better access to care than those in rural areas. This map is also found on page 71, but it indicates the areas with the highest concentration of coronary heart disease versus the lowest areas of concentration of coronary heart disease, the hot and the cold spots. Arkansas, Louisiana, and Mississippi have a higher concentration for coronary heart disease when compared to other states in the region. Lower incidences of coronary heart disease in Alabama and Georgia doesn't mean that coronary heart disease isn't a public health concern. Areas that have lower coronary heart disease numbers show an effective use of public health initiatives to address the issue. Now we come to our second condition that we're going to talk about for the southeastern United States, and that is diabetes. What is diabetes? Diabetes is a group of metabolic diseases characterized by hyperglycemia resulting from defects in the insulin secretion, insulin action, or both. What this means is that our body builds up sugar and it doesn't expel it the way it should, so it builds up, which can lead to problems. Classic warning signs of diabetes include excessive thirst, excessive hunger, and excessive urination. In a different way, these conditions are referred to the three P's of diabetes. For excessive thirst, it is polydipsia. For excessive hunger, it's polyphagia. For excessive urination, that is polyuria. If a person is experiencing one or more of these symptoms, it is a classic warning sign that they need to have their blood work done to check if they've developed type 2 diabetes. Over 40 million Americans, or about 12% of the population, are living with diabetes. Of the 40 million people living with diabetes, 29 have been diagnosed, whereas 11 million living with diabetes are undiagnosed. There are three types of diabetes. Type 1 is also known as juvenile diabetes because it usually presents itself very early on in early childhood. Type 2 diabetes can present itself at any point in someone's life. And gestational diabetes usually only affects those that have the ability to become pregnant because it affects them during the pregnancy. Long-term damage from diabetes affects the kidneys, the eyes, the heart, and blood vessels. Diabetes prevalence in the southeastern United States has many contributing factors. For the study, Sharma identifies diabetes as the sixth leading cause of death for the southeastern United States. Again, we can see from the diabetes prevalence map how location and income inequalities affect the prevalence of diabetes in the study area. Other factors include access to care, dietary choices, physical activity, levels of education, etc. But just increasing access to care alone does not address itself the diabetes prevalence issue. It must be a multifaceted approach. As we can see from the diabetes hotspots map found on page 79 of our textbook, there is a very clear distinction of where the incidence of diabetes does occur. This is also the area that is referred to by the CDC as the diabetes belt. The CDC identifies the diabetes belt mostly in the southern U.S. People who live in the diabetes belt are more likely to have type 2 diabetes than people who live in other parts of the United States. Mississippi, Alabama, Georgia all fall into the diabetes belt as demonstrated by the hotspot map that we use in the study. Now we're going to touch base on the condition known as obesity. Obesity is a condition that is associated with the excessive accumulation of body fat that results in a BMI of 30 or greater. Obesity in the United States has risen dramatically over the recent decades. Sharma identifies contributing factors to the rise in numbers of obesity. This includes an increasingly sedentary lifestyle, poor dietary choices, and other environmental influences. As indicated by the obesity prevalence map, the southeastern United States, the levels of obesity are highly pronounced with alarming levels of prevalence and associated health complications. The region's cuisine, marked by high calorie and high fat foods, are also linked to the rates of obesity. The lack of recreational facilities, safe walking paths, and parks also contribute to the rising obesity levels that we see indicated on the map on page 86 of our textbook. This map indicates the higher levels of prevalence of obesity in the southeastern United States. Of the states in the study area, Mississippi and Louisiana had the highest levels of obesity observed. The CDC reports that both Mississippi and Louisiana as ranking among the highest in obesity across the nation, with Mississippi reporting 40.4% and Louisiana reporting 39.2% of their respective populations of living with obesity. Obesity is also linked to other health issues like diabetes, cardiovascular diseases, and certain forms of cancer. Addressing obesity requires an individual and community level intervention and policy changes that promote healthy food choices, exercise, and wellness education. Now that we've talked about coronary heart disease, diabetes, and obesity, let's look at what the states are doing to address these conditions where they are. Let's start with Alabama. The Department of Public Health designated the third Thursday of November as National Rural Health Day. In 2022, Governor Ivey proclaimed this as Rural Health Day in Alabama. This observance highlights the distinctive health challenges that are faced by people in rural communities and honors the collaborative efforts of individuals and organizations dedicated to enhancing healthcare access and quality in rural communities in Alabama. Let's have a look at what they're doing in Arkansas. The Arkansas Center for Health Improvement launched the Healthy Active Arkansas Initiative in 2015. It aimed at reducing obesity and increasing physical activity levels among residents through the implementation of public policies and community engagement. There was a case study they cited for the use of, public funds, which is the City of Batesville case study. Prior to becoming mayor of Batesville in 2007, Ellen Baugh spent more than 30 years teaching physical education and health in Batesville schools. When he was elected mayor, following some early success replacing critical wastewater infrastructure for the city of Batesville, Ellenbaugh turned to his passion of physical activity and health. Beginning with community gardens, Ellenbaugh and his city officials implemented initiatives to change the community's health and wellness, including starting a Greenway Trail that was funded by a grant, the expansion and connection of various walking trails through grants, the development of a community center and sports complex, and collaborating with America Walks to create safe, accessible, and walking environments for the residents of Arkansas to use. Now let's look at the state of Georgia. In 2012, they initiated two health-centered initiatives. The first being Healthy Communities Initiative. It was designed to allocate funding to local communities to foster supportive and environmental systems that encourage healthy lifestyle choices. The other program they initiated in 2012 was the SHAPE program. It was aimed to increase physical activity and improve nutrition in schools to mitigate childhood obesity. It also implemented wellness policies and resources designed to foster healthier educational environments. The initiative that Louisiana took, they named the Well Ahead Louisiana Initiative. Its mission is collaboration throughout the state to connect communities to tools and resources that can improve the health of Louisiana residents where they live, work, learn, play, and pray. The approach they're taking addresses the social determinants of health to help residents consistently make healthier choices. The state of Louisiana is very proud of their rich cultural heritage and their cuisine, but also is very cognizant of the fact of the impact that the diet has on chronic disease prevention. The state of Mississippi started an initiative called Uproot that was a collaborative effort between the Department of Public Health for the state of Mississippi and 90 different businesses, communities, organizations, nonprofits, and state agencies. It recently rebranded itself as Make Mississippi Healthy Again, but its core mission remains the same: to empower residents of Mississippi to live healthier and fuller lives through better food choices and healthier living choices. Mississippi's approach is like what other states in the study have done, but these approaches alone aren't enough to improve the conditions just by themselves. It requires community involvement, on not only just the city, but county, state, and federal levels for that matter. The state of Tennessee Department of Health is improving its population health by investing into a diverse portfolio of over 50 program areas. The state of Tennessee Department of Health maintains a comprehensive health database that provides health practitioners and policymakers with essential information to support effective planning and decision making when it comes to public health. Notable programs include the Commodity Supplemental Food Program, Diabetes Management, Family Health and Wellness Initiatives, the Farmers Market Nutrition Program, and the Office of Primary Prevention, whose efforts focus on the prevention of heart disease and stroke prevention. For more about these particular initiatives in Tennessee, you can visit their website listed below. And this represents the end of my presentation. This is the reference list of the sources that I used throughout the presentation. I'd like to take this time to thank Professor Sharma for the ability to participate in this class. And hopefully, through my micro lecture, I can help improve the health situations of the study area. Thank you very much, and have a good summer.